Management of rash in children. Rash is a common complaint of the parents. So let us talk a little bit of neonatal rashes. The erythema toxicum neonatorum, they are quite common. It comes and goes. The child is otherwise healthy, playful, nothing, no cough, no distress, nothing, no illness. Breastfeeding, playing, all this and that. And it comes by 3 to 4 days, it goes by 7 days or so. And in the grown-up child, one to two afterwards, this can be arterial rash is quite common. So, and then can be at times giant urticaria and at atopic dermatitis seborrhea, like lesions is also common. They are to be treated with the steroid ointment locally and at times systematically, mostly locally. And then loxicalaviran is good for the arterial rash. When the child has fever with rash, usually it is viral fever. So once upon a time, in we saw in our early days, measles was quite severe, and then slap cheek sort of rash was quite common, and it's quite troublesome at times in malnourished child. It had some casualties also. But nowadays, with the advent of vaccination, they are much less nowadays. But other viruses, plenty of viruses, wide variety of hundreds and thousands of viruses are there. They can cause rash. So the viral fever, running nose, all this and that, don't do anything. Wait and go and see. But commonly, the dengue epidemic, little bit of in a waning state. So see whether it is the dengue. Look for the other signs of the features of dengue, and means that the BP. If it is hypervolemic, we should do the NS1, IgM, and then CBC for dengue diagnosis. Otherwise, other cases you don't need to do it. And in ITP, mostly following viral hepatitis, viral infection, you can have immune thrombocytopenic purpura. In those cases, you should check the BP and do and see the your sign, which is to be checked with the amount of rash 5 or 10 with the BP between the systolic and diastolic, and marking this rash. Uh, um, Graves sort of rash is possible in the leukemia, aplastic anemia, Graves sort of diagnosis. Here you have some red flag signs like in hepatosplenomegaly, lymphadenopathy, fever, toxemia, severe pallor, and the bone marrow tenderness, bony tenderness. In aplastic anemia, you do not have bony tenderness, no organomegaly, but you do have the marrow failure features like infection because of the your low WBC count, and you have severe sort of pallor. So these are the grave diagnosis on the other spectrum of the rash evaluation. You have vasculitis. Your IgA vasculitis is previously used to call it henoxylin purpura, and few more in lupus nephritis and few more lupus and other vasculitis. You can have rash. So there is wide variety of diagnosis involved with the rash. Examine the child clinically and see which one is common. By far, the benign diseases they are more common. Insect bite, drug rash are also there, and even you look for the CNS and heart, because the vasculitis you have widespread organ involvement including heart, lung, brain, everywhere. So these are the methodical way of evaluation of the rashes in children.